Back pain is so common, it's really part of the human condition. It's the curse of being bipedal almost, of walking on 2 feet. In fact, if you look back in time, archaeologists found Egyptian hieroglyphics that describe back pain and some interesting remedies, almost 3,500 years ago. But despite that long history, it's still a tough topic for patients and for doctors. We all tend to look at the problem differently. The primary physician may wonder, should I worry about this patient? The surgeon is wondering, can I operate or should I operate? Will the patient get better if I operate? And the radiologist, if you don't already know, you'll find out soon enough. There's so many findings on imaging. What do they all mean for the patient, and how do I prioritize them? So our goal for tonight is to describe how some spine interventions can hopefully bridge this gap. And the message that we're hoping to convey is the following. By integrating patient history, clinical examination, and imaging findings, CT-guided injections do 3 things. They provide effective treatment for certain patients with stereotypic back pain syndromes. They increase the specificity of diagnosis beyond which can be done with clinical examination or imaging alone. And then they enhance the precision and the safety profile of spine interventions as they're done using different modalities. So I'm going to discuss some of the epidemiology and the natural history of back pain. And then even though I'm a radiologist, I'm going to stand up here and point out the significant limitations of imaging, in particular MRI, and introduce the role for spinal injections. And finally, I do want to touch briefly on the topic of radiation and CT, since in our practice we use CT for injections.